A special type of repair is what we are going to see as the adjacent tissue transfer or the transposition repair. So here what we are going to do is there are several synonyms for this adjacent tissue transfer, Z-Plasty or Y-Plasty. The speciality of this type of repair is that we are not supposed to code the excision. So what happens is, imagine if the physician wants to repair a lesion, what he's going to do is he's going to excise the lesion. So usually such lesions are going to be malignant lesions like squamous cell carcinoma, basal cell carcinoma or malignant melanoma, or it's rarely you might have a B-cell lymphoma, those types. Such times what happens is the physician excises the lesion and then he is going to transpose the neighboring tissues and close the original site. So there is a primary defect after excision and then there is a secondary defect. So at the end of the thing, what happens is we will have to report only the code for the adjacent tissue transfer. Do not report excision separately. So this is a specialty. Because unlike other excision, if it's going to be intermediate or complex, we will have to report the excision code separately and the repair code separately. Whereas here, the adjacent tissue transfer code bundles the excision code. In case you find in the option, if there is an adjacent tissue transfer code plus there is an excision code, in that case, how can you sense? The excision should be done for a different site. The adjacent tissue transfer should be done for a different site. Fine? Okay. Now here is an example where there is a removal of a 2 centimeter basal cell carcinoma of the trunk. So this would be coding as 11602 and adjacent tissue transfer of 10 square centimeter is 14040. Don't code excision. That's it. It's a code for. So that's a specialty. Depending on the square centimeter, we have different code sets and we also have add-on codes like if you have if the adjacent tissue transfer is going to be for higher lesions, higher square centimeter, then we have to report the other codes like 14301, 302, those codes. Okay. Thing is, just bear in mind, don't report the excision codes.